So much of our miserably failed response to COVID made no sense. Masking, devastating shutdowns, the sabotage of early treatment, rapid approval of remdesivir, and the maniacal reliance on the COVID-19 injections.
COVID-19 vaccines have saved millions and millions of lives.
The Senate Subcommittee on Investigations debated about adverse effects surrounding COVID-19 vaccines.
It still has been difficult to get the documents. I think we finally got enough documents to certainly demonstrate in this case with myocarditis that the federal government was well aware of it, downplayed the severity, and hid what they had actually found. So
let's be clear. The allegation is that they purposefully concealed evidence. I am unable to support that conclusion with this evidence.
Witnesses consisting mostly of doctors were brought in to testify.
Now, the topic today is myocarditis or heart damage from the COVID-19 vaccines. I'm a cardiologist. I know the topic well. I've examined thousands of patients with this problem. Thousands. Before the pandemic, I had 2 patients ever with this problem.
I also heard that deaths sharply declined in 2021. Well, when you look at all-cause mortality in the United States, deaths in 2021 went up compared to 2020, and presumably most of the most frail, the weak among us died in 2020 from COVID. We should have had a reduction in all-cause mortality in the United States. We did not.
But I've seen firsthand children dying from the spread of preventable diseases because of vaccine skepticism, because people lose faith.
One witness says he suffered from injuries after taking a COVID vaccine and had to quit his medical career.
I proudly elected to get vaccinated, and within a week, I developed leg weakness, numbness, substantial balance loss, leading to falls, including one while treating a patient. I was stunned that my providers dismissed any vaccine link, despite news of similar cases halting the AstraZeneca trial in the UK.
Another witness alleges that pregnant women were coerced into getting the COVID shots.
These entities falsely assured pregnant women that the vaccines were proven safe and essential for maternal and fetal newborn health, despite the fact that early evidence indicated quite the opposite.
Witness Dr. Jordan Vaughn disputed the use of ventilators on COVID patients during the pandemic.
This was primarily a vascular disease, not a pulmonary disease. And that's one of the reasons that ventilators are probably one of the most ineffective things you could have done to people, because if you have a vascular disease of the lungs, increasing the intrathoracic pressure just closes down more vessels and ultimately kills them.
Chairman Johnson indicated that there will be more hearings on COVID-related topics in the future. Reporting in Washington, D.C., Jason Blair, NTD News.